Good evening. So look at this image. Frontal bone. And the inside we can see this cavity. On the back side we have occipital bone. On the side we are having temporal bone. Now we can see this cavity inside. Inside the cavity and the outside there are lots of nerves. The number of nerves. So the some nerves coming from the eyes. These nerves coming from eyes. We can see the eyes are here. They are the eyes. So some nerve going from the eyes, we can see here on the back side. And they are coming to the cavernous sinus. Okay. So the outermost covering of the brain is skull. So we can see this skull. Inside we are having too many structures. Now if we step by step we go inside. So the outermost is skull. Now if we go step by step downward or the inside. So let's see here. So this is the outermost layer of the skull or the skin. We can tell it skin. Because we have skin on the head. Then as we go down, we are having hard skull. So the uppermost part is the skin, then we are having hard skull. So we can see here. So this is the skin of the head. Then we are going inside. This is the skull or the bony part. Then we are going in. Then we are having three layers. Layer number 1, layer number 2, layer number 3, or 3 membrane, or 3 layers. They're the very important layers. They're the very important membranes, these 3. Okay. So these are called DAP. The outermost layer is called D. The middle layer having too many granulation, that is called A. And the inner layer is called P, DAP. So let's see here. This outermost layer is called D. D means Dura matter. Then the middle layer is called A. A means this is written arachnoid matter. Arachnoid matter. This is the middle layer. Then the third layer. So this is the Dura matter, we can see. Dura matter. This one. Then the second one is the arachnoid matter. This is the arachnoid matter. Okay. Then the lower one is the P or the pia matter. So DAP. So I will draw with the color so we will understand. So the outermost layer is called D or the Dura matter. The middle layer is called A or the arachnoid matter. And this inner layer, this one is called P or the pia matter. So these are 3 membrane or 3 folds which is covering the brain. So I told you first is skin, then bony part or the skull, then these three layers, then we are having big brain. Then these are the entire brain. So brain is fully protected. Then we are having brain. Okay. You might have heard brain fever. What is the brain fever? Where it happened in the brain? Like when someone is having very high fever. Sometimes because of the very high fever, sometimes it's going in these membranes. Okay. These membranes are called meninges. Meninges. Dura matter, arachnoid matter, pia matter. They are protecting the brain. Not only brain, these three layers is in the spine also. These three layers are the continuity of the brain as well as the spine. Dura matter, arachnoid matter, and the pia matter. So when these are called meninges, meninges means membranous. So sometimes what's happening, if the person is having very high fever, then what is happening? Then we can see many times person start getting some seizures or the epileptic fits. So the fever might reach at these layer 1, 2, or 3. These are meninges or the membrane. So it is called meningitis. Meningitis means inflammation of meninges. What is meninges? Meninges are the layer who are covering the brain and spinal cord and protecting them. Sometimes there is some fever, very, very high fever. So this part is getting affected and the person is getting inflammation here and it's called meningitis. I know when I was working in hospital, so there were one very famous allopathic doctor who used to go give sleeping pills if the person is having high fever like malaria or any disease where the person is having very, very high fever. So he used to get sleeping pills also. I was asking, this person is having fever. Why are you adding the sleeping pills in this prescription? What is the role of sleeping pills? Then he told, because of this fever, because of some fever, when the heat is becoming too high, person is not able to sleep for 3 days, even the 4 days. If the person is not sleeping, then the heat will increase in the brain and then person will suffer with the brain fever or the meningitis. So when we are adding sleeping pills, person will sleep. But definitely we are bringing the sleep forcefully, but it will cool down the brain. Then person will not suffer with the brain fever or the meningitis. Okay. Even there are many other problems might happen in the brain. Now, sometimes fever is happening in the brain itself. So look at here. So these are the three layers. Layer number 1, D, layer number 2, A, and the layer number 3, P. Some patient might come to you for the treatment of epileptic fits or the seizures. You will take the history, then they will tell first time got seizure when he suffered with the very, very high fever. We can see in many kids, we have seen this. Okay. Sometimes what's happening, the brain itself is involved. Okay, now we are not talking about the membranes. Sometimes brain tissues getting the involvement. Brain tissue is getting some problem. Okay. Then we are telling encephalitis. What is the meaning of encephalon? Then person is called then it's called encephalitis. Okay, the encephalitis, in means inside the head, or we can tell the entire brain. So sometimes person is getting the involvement of this brain tissue, or we are telling brain parenchyma. And this is getting inflammation. Because it's happening inside and the entire brain. So in means inside, means the entire brain is involved, and this is called encephalitis. Right? So we can tell encephalitis is a really very difficult problem. It's a there are cerebrum might involved, cerebellum might involved, the brain might involved in the encephalitis. Encephalite means entire brain. Bigger brain, small brain means cerebrum, cerebellum, brainstem, all part of the brain might suffer. Sometimes you will get the patient, you will get some patient with the reports. Then you will take the history, then they will tell, yes, this patient got meningitis in the childhood or in the young age, or the encephalitis. Now it is okay, but this person is having, when this person is walking, he is walking with a limping. He is not walking properly, he is limping. लंगड़ा लंगड़ा के चलता है आपने देखा सारी all the reports are normal, everything is normal. Then we are giving some osteopathy session to balance if some effect is left in the brain. So it was the encephalitis. So we have understood meningitis and the encephalitis. Now, malaria is a disease. Malaria. In the malaria, actually in India, also it's common, but in many countries like the South Africa, it's very, very common, very highly common in the South Africa. Okay. And there might be some other country also. So when the malaria is becoming very high and uncontrollable, sometime again you are forgetting, like given the example of a doctor who used to add the sleeping pills, but many doctors are not adding. Maybe they are having, I'm not telling they are right or wrong, as per maybe some other reason. If the fever is, the person is having malaria and the fever is reaching to the brain, so that is called cerebral malaria. First malaria in the body, then it is going in the cerebrum. Okay. So that is also common cerebral malaria. These type of patient will be coming you after 10 years, after 15 years, maybe after 5 years. Then you will take the history. Okay, have you suffered with some problem in the past? Yes. Once got malaria, then he got some effect on the brain, and after that he be hospitalized. Then he became okay. Okay. But now it's okay. There is no effect. Now nothing. Okay. But this is a very important history. It means he got malaria, and after the malaria, if the person is getting some seizure, some epileptic fits, or some brain-related problems, it means it is reaching on the brain. So the outer part of the brain, that is called cerebrum. Okay. So the cerebrum means this is the outer part, brain, right? This is the cerebrum, entire part cerebrum, frontal lobe, parietal lobe. So that is also called cerebral malaria, which is in the cerebral cortex. Okay. There are a few more diseases, but I will tell you, person will be getting very high fever. If the fever is reaching to the brain, then this is the acute condition, and most of the time you will see patient is hospitalized because patient is having very high fever. 104, 105, 106. The small kids having more tolerance. If the kids are having 106, 107, adults are having less tolerant. As we grow, we cannot tolerate too much fever. But as we child, we can tolerate more fever. In the childhood, even I have been seen 107 degree Fahrenheit. Okay. But in the adult, if the person is crossing 105 now, it's very high. Person is getting very high fever, headache, stiff neck, seizures, and even person might go in the coma, nausea, vomiting, and all. Okay, speech problem. I have seen many patients like this. They are coming after many years, maybe. Then parents are telling one young boy came at the age of 20, 21. He was limping while walking, and he got cerebral malaria in the childhood. Then he told after that time, after 3, 4 months, he started limping, and we have done all the reports, but all the reports are normal. There is nothing in the report. Okay. So now we will be seeing, if we see the outer part of the brain, so brain, we can see the outer part is skull, skin, then the skull. Okay, skin, then skull, then DAP, then the brain. This is the sequence. Let's talk about the D. Now I'm focusing on the D. D, Dura matter. Okay, so let's focus on this D, Dura matter. If you look at the Dura matter here, so it's a covering the entire brain. So the outermost layer we have told skin and the skull. Now we have reached on the dura mater. So the dura mater is covering the brain. We can see this is the covering of the brain, and inside then, and also dura mater covering the spinal cord. We can see this is the dura mater covering the spinal cord. Then dura mater going down. Then see dura mater is coming till the sacrum, right? We are doing the treatment of the sacrum, and it's working on the brain. Okay, we are manipulating the sacrum, and it will remove if there is any problem in the brain. Why? Because of the connection of this dura mater. It's like a seat, bed seat. Like there's a bed seat. You are standing on one side, and you are pulling the bed seat, and you are stretching the bed seat. So definitely, if something is on the other side of the bed seat, it will get affected or not. It will get affected. So when the female is having some menstrual problem, there is a problem in the sacrum, then immediately they get headache that is going through the dura mater. Even vice versa, some problem of here can transmit there, some problem is there can transmit here, but sacrum is the very important place, and we are doing treatment of the sacrum, and with the help of sacrum, we can heal lots of problem. Sacrum is a very, very important place because it's having connection with the dura mater. So let's see now here. So dura mater, not only in the brain, the continuity on the spine also. Let's remove the dura mater. I'm removing the dura mater. Let's see. Okay, I'm going close now. I will remove 1, 2, 3, removed. As soon as we remove the dura mater, now another layer of the dura mater. Oh, okay, okay. Another layer. Fine. Okay. So it means there are two layers of the dura mater. Let's go back. Yeah. So the outer layer is called periosteal layer. The osteo means bone. The outer layer is called periosteal. Why it's called periosteal? Because it is just below the skull. Bone, skull. Bone means osteo. Okay, like osteopathy, science of bone. Not only science of bone, joints, membrane, fascia, all the inner organs, liver, gallbladder, kidney, urinary bladder, all. Okay, but osteo means bone. So the layer who is touching the bone, that is called periosteal layer of the dura mater. Okay. Now let's remove once again. So this is the periosteal layer of the dura mater. Now I am going to remove this layer once again. This is the removed. Now this is the second layer called meningeal layer, because now it's connected with the other meninges like dura mater, arachnoid mater, pia mater. So that is the meningeal layer. Second one. Why the meningeal layer? Because it's connected with the other meninges. We can see this is the meningeal layer of the dura mater. These two layers are very important. Okay. Why these two layers are important, I will tell you very shortly. Remember, the outer layer is periosteal and the inner layer is meningeal. Something in between these two layers, which is very important. Okay. So please make sure you are seeing them very carefully. Now let's remove this also. I am going to remove this meningeal layer of the dura mater. 1, 2, 3, removed. Wow. Now, what is that? Now we got D is over. Now A. Arachnoid matter. We can see how this is making beautiful network all around the brain. This is the arachnoid matter. We can see. Okay, this is like a network. This is the arachnoid matter. Okay. So what is the importance of arachnoid matter in the brain? The arachnoid matter is the second layer, meningeal layer. Fine. Now let's remove this also. Okay, let me remove this one also. This arachnoid matter we can see not only in the brain, all the layer in the spine also. Let's see this. In the spine also we can see dura matter than the arachnoid matter. Okay, fine. Let's remove this also. Removed. What is that? Now the third layer or called P or the pia matter. This is covering the entire brain. We can see. This is not only covering the brain, even this is covering the spinal cord. We can see till the last. Okay. So DAP. Let's remove this. Let's remove pia matter 1, 2, 3 removed. What is that? Now brain. Brain. Okay. Fine. So now let's go back. Let's go back. Okay, this is the outermost layer of the skull or the dura mater. Fine. Can you see any venous sinus here? Can you see any veins here? No, we can't see any vein. But as soon as we remove this, now we can see, wow, this is the superior sagittal sinus. This is the transverse sinus. So these are the sinuses in the two layer of dura mater. That's why we are telling them dural venous sinus. Now we can see the two sinus located inside the two layer of dura mater. Yes, fine. So now if I ask you what is the dural venous sinus, space between two layer of the dura mater, the outer layer is attached with the bone means skull. The inner layer attached with the other part of the brain like the meninges. In between we are having space. In that space we are having veins. So that's why it's called dural venous sinus. Okay. Wow. Now, if we remove this, okay, let's remove this inner layer of the dura mater. Removed. Now we can see this the very beautiful network of the arachnoid matter. What is the importance of arachnoid matter? The importance of the arachnoid matter having very important thing that is called CSF. CSF, cerebro spinal fluid. Okay, getting my point? Cerebrospinal fluid, very important fluid of the brain. Okay, so this is the importance of the arachnoid matter. Arachnoid matter is having CSF. Okay, fine. If we remove this, then we are having pia matter. Pia matter is covering the brain. So this is the few things about the all the three layers. Fine. So CSF is the very important thing in the brain. Sometimes we see CSF is increasing. CSF is there is a factories in the brain. They are producing CSF. That factory will be discussed in the next class. CSF is coming, then it's going back. Like in our wash basin, water is coming, but it's also going back. What will happen if it is coming but not going back? What will happen? If it is happening in the childhood, baby, this very soft. Even these are not fused. What will happen if CSF? The formation is happening, but it's not going out because these are not fused properly in the small infant of the baby. What will happen? This will become bigger. In the baby. Why? Because still these sutures are not fully fused. What will happen if there is a formation of the CSF is happening, but it's not draining in the baby, infant, or in the adult? If it is happening in the baby, then baby will sub we are telling, okay, पानी भर गया सिर में. वो पानी क्या है? वो CSF है. That is a excessive CSF in the brain, or that is called hydro means water, brain means hydrocephalus. Have you seen the patient of hydrocephalus? क्या सुना है hydrocephalus बीमारी? I will show you. You will put in the Google, you will see hydrocephalus. So baby head is becoming bigger. We can see here. Let's see now. So the hydrocephalus, we can see how the baby head is becoming bigger. The hydrocephalus, you can see hydrocephalus, hydrocephalus, hydrocephalus. Okay, the meaning of hydrocephalus, there is a formation or happening, and it is happening, but there is no excretion of the CSF. Okay. Then what will happen? The baby will be suffering with many problems. Okay, like seizures, delayed development of the brain, and there are multiple problems of the brain. The problem of everywhere, eye problem, hearing problem, all the problems. Like, so this will happen only in the baby. Okay. In the adult, it will happen or not. In the adult, it's difficult because in the adults, what will happen? Suture are fused. Now brain cannot be enlarged. So if you see the adult, In the adult, what will happen? The pressure will increase. Pressure. Okay. So suppose there is a balloon. If you fill the balloon too much, balloon will be increase in the size. So what is happening if you see in the adult? In the adults, the head will not become bigger, but there is a too much pressure inside. See some spaces inside the brain, like we can see this ventricle is becoming enlarged or the bigger. So inside the brain, outside it's looking same. Okay. So we can see in any image, like we can see in the adult, if you see in the elder age, the space who are producing the CSF, the space who make the CSF, they are called ventricles, and they will get enlarged. What will happen? Severe headache. Okay, severe headache, and there are many problems, coma, death, many might think happen, right? So it's very challenging problem. Okay, so there is a formation of the CSF. CSF is getting collected in the, so we have seen dura matter, we are having dural venous sinus. Arachnoid matter, we have CSF. Okay, is it clear or not? It's clear now. So we should understand when the person is coming to you, exactly what the problem is happening with the person. So let's see here. This person is having problem with the meninges. So the problem with the meninges, it is meningitis. So we can see the meningitis, there is a stiff neck. Okay. There is inflammation in the meninges. There are too many problems happening in the meninges. Swollen meninges. We can see these are the infected meninges. We can see the redness in the meninges, inflammation in the meninges. So that is the meningitis. Okay. So we can see here in the other image when the intracranial pressure is increasing. So we can see this is the meninges. This is the spinal cord. We can see from the outside skin, then the skull. Then we are having meninges. So sometimes there is a intracranial pressure is increasing. Okay. And the person is getting many problems like nausea, vomiting, death. Okay. Okay, fine. So let's see this image. In this image, I want to highlight this is the frontal bone in the front side, the frontal bone. This is the right parietal bone and this is the left parietal. The junction here, that is bregma. Yesterday we have discussed this is the bregma. In the front side, we have frontal bone. A junction is bregma with the junction of frontal bone in the and the parietal bone. And this is a suture between the frontal bone and the parietal bone on this side as well as this side. The name of the suture is coronal suture. Coronal suture. Okay. I will show you in other image. If you look at this skull, this is a skull. So this is the frontal bone, this is a parietal bone, two parietal bone. In between, we are having suture. So in the center, we are having bregma, and this suture is called coronal suture, who is separating frontal bone with the parietal. Now, one more thing I want to highlight here. We told yesterday, falx cerebri. Okay, but upper is superior sagittal sinus. What is the falx cerebri? Okay, I will tell you. So this is the superior sagittal sinus. In the center, we can see. This is the inferior sagittal sinus. We can see in this image. Okay. In between, we are having one membrane. Yesterday I told you. In between, we are having one connection, one membrane. Who is connecting the superior sagittal sinus with the inferior sagittal sinus like this? This membrane is made by dura matter. So the falx cerebri is the foldings made by dura matter, the outermost part of the brain, outermost part. So made by dura matter. Okay. One more thing you have to understand here. So there's the inferior sagittal sinus. Okay. So we are looking from the front side. Now we are going on the back side. So the superior sagittal sinus meeting on the confluence of sinus. So superior sagittal sinus and the confluence of sinus. So this is the confluence, meeting point. The inferior sagittal sinus is opening in the straight sinus. This is the straight sinus. Then it is also meeting on the confluence of sinus. This we already discussed. Now, superior sagittal sinus bringing the blood from the upper part of the brain, but the inferior sagittal sinus bringing the blood from the deeper part of the brain. So one thing I want to add here, there is a one vein, maybe in this image it's missing. I will draw the one vein. So this is the inferior sagittal sinus. So we can draw like this till here. And one vein is coming from the deeper part of the brain, who is also bringing the blood, and they together becoming straight sinus. So there's the straight sinus. So the name of vein who is bringing blood from the deeper part of the brain called vein of Galen. Okay, remember this. It's very important. That's why I'm introducing you this. So inferior sagittal sinus and the vein of Galen bringing blood from the deeper part of, especially vein of Galen bringing the blood from the deeper part and becoming straight sinus. Okay, then going further. Clear? So now I will give you quiz now. कौन सी quiz number है? What is the name number of this? Maybe 7. So give this quiz, then we'll discuss. Okay. Give it. I will also put in the chat box here. Once you give the quiz. This quiz on the basis of discussion what we did yesterday.